Another really great time management tip is so important, so great. Hey everybody, welcome back to my channel. It's Kimmy D here. Today I'm going to be coming to you with a video on time management tips for new licensed practical nurses. So I just feel like there are some time management tips, some general time management tips that every nurse should have, because we all know how hectic it could be, especially if you're one nurse, you have 40 residents, you have 60 residents. So these tips will help you learn along the way. These are kind of like the unspoken rules, the unspoken tips that nobody really tells you about. So if you guys want to know that information, sit back, grab a snack, and enjoy the show, okay? Let's go. Okay, so my first tip with time management is, especially if you're working the morning shift or evening shift sometimes, or night shift sometimes, is to write down your finger sticks first. So when you first come in, especially if it's morning shift, if you know you have people who are on finger stick, you take a sheet of paper and then you write down the list of people who are on finger stick. So you write down their names and then you go around and you take everybody's finger stick. That way they will have their insulin or not have their insulin before they go and eat breakfast. Write down any feedings and treatments that you may have. Now, I gave this advice on the past. So basically, especially if you're working the 3 to 11 shift, you're gonna write down on a sheet of paper to write down everybody who is on feeding. So it's a good idea to have a little notebook that you take with you, especially if you're a floating nurse, which more than likely you will be floating as a new nurse in a long-term care facility. You take a little notebook and then you write down which floor that you're working on. So if you're working on third floor, write third floor, and then write down the name of the patient and what feeding they're giving. So their name and then Gevity 1.5 and then Tina, Gevity 6.8, whatever. And then also you're gonna write down their treatments that they get if you are giving treatments, so that you can make your life easier. So just take a sheet of paper, go in the TAR, the treatments, and write down everybody who needs treatment and write down specifically what treatments they get. So for example, Jamie gets Silvadene to his sacrum and cover with DPD, which is dry protective dressing. And you do that with every single person who's on treatments, so that when a CNA asks you for treatments, you can just refer to your sheet. Management hack is, when you're doing your treatments, depending on how strict the facility is, it's a good idea to prepare your treatments in advance. So let's say you're giving someone Zeroform, you prepare your Zeroform, you prepare your gauze, and you prepare any supplies that you need for that treatment and put it by the patient's bedside. You could put it on the bedside table or anywhere where there is space. And remember, it's depending on how strict the nursing home is, so that when the CNA calls you, you can quickly do your treatments there, because it can be really hectic if you are giving medications and treatments. So to have that prepared is awesome. When you first come in, ask the nurse, is there any patients that I need to look out for? Is there any patients who are combative? Because you're gonna want to know which patients are combative with you, because those patients are probably gonna take the most out of your time. Those who are very confused, because you're gonna have to sit down and speak to them saying, hey, it's okay, this is your medication. So you're gonna wanna know who's combative and who's not, because you wanna organize your time and get all the people who are easy to give medications out the way, so that you can focus your time on the patients who are combative or those who give issues. And plus, it's good to know, because if the patient is combative, you know to have a certain physical distance with the person. You'll know how to interact with that patient, so that you're not caught off guard, and if the patient swings at you, you're not like, oh my gosh. Another great time management tip is, when you're giving blood pressure medications, it's good to have a small blood pressure machine cuff thing. Instead of bringing along that blood pressure machine, you can just use your blood pressure cuff. Of course, it depends on how strict the nursing home is. Sometimes they will allow you to do it, sometimes they won't, but that is an easy way to save time. So you can just take the patient's blood pressure or take the patient's pulse and then quickly give them their blood pressure medicine. Another really great time management tip is so important, so great. Don't go from room to room. What I mean by that is, if majority of your residents are in the day room, that is the perfect opportunity to give everybody medications, because everybody is in one place, but the fact that they're all there in one area really reduces time because you don't have to travel from room to room to room. So this tip is very, very important. When you first come on the unit, make sure that you prepare your med cart, meaning make sure that make sure that you have enough finger stick strips. Yes, some nurses will leave you with one finger stick strip or no finger stick strips, so that when you're giving finger stick, you may run out, and then that'll be a nuisance to go and look for your finger stick strip. So make sure that is stacked up, make sure your cups are stacked up, make sure your med cart is set and ready to go. Those are some basic general time management tips that I could think of. So if you guys have any time management tip for new nurses, definitely leave it down below. I hope you guys enjoyed this video. If you enjoyed this video, remember to give it a thumbs up. Leave your comments down below on any video suggestions that you have. Leave any comments down below if you know these time management tips, if you've used them before, and I'll see you guys next time. Bye. Mwah.